Hello, everyone. I am Dr. Omozusi, a dentist at the University of Benin Teaching Hospital, and the title of my presentation is A Representation of Eagle Syndrome, a Case of Unilateral Styloid Process Elongation. Eagle syndrome is characterized by the elongation of the styloid process and/or the calcification of the stylohyoid ligaments, presenting as a range of symptoms. It was first described by Eagle in 1930s with two main forms identified, the classical and the vascular types. Elongation can reach extreme lengths with documented cases of up to 6.97 cm. The styloid process is a slender projection of the temporal bone, typically measuring 25 mm in length. It serves as an attachment point for several ligaments and bones. It's a 34-year-old female presented with right recurrent submandibular swelling over the past 2 years. The patient reported sharp head pains, headaches, and radiation of this pain to the right ear. She experienced difficulty opening her mouth, chewing, and occasional crepitals when turning her neck. Notably, there was no history of head or neck trauma or previous surgeries, and symptomatic relief was transient with analgesics. On examination, a firm diffuse swelling was noted, medially related to the angle of the right mandible. The swelling was tender and attached to underlying structures, but not to overlying skin. Initially, a submandibular salivary gland pathology was suspected, and an ultrasound scan was requested to confirm our suspicion, which was, however, inconclusive, necessitating a CT scan evaluation. The CT scan findings showed a right unilateral bulbous elongated styloid process measuring about 4.5 cm. This imaging confirmed the diagnosis of Eagle syndrome. The management and treatment of this patient were both the conservative and the surgical management. The conservative management initially included NSAIDs and diazepam, providing only transient symptom relief. And the surgical intervention, a transcervical approach, was chosen for styloidectomy, involving general anesthesia and a McPhee incision. The styloid process was resected using a micro-oscillating saw, followed by fracture with a bone nibbler. The post-operative care for this patient was prescribed a course of amoxicillin, clavulanic acid, metronidazole, and ketorolac for 1 week. And the follow-up was at 1 and 2 weeks and 8 weeks, showed complete resolution of preoperative symptoms. Eagle syndrome should be considered in differential diagnosis for unexplained head and neck pain. Symptomatic presentation often involves chronic pain in the throat, ear, or neck with potential radiation of adjacent areas. The transcervical approach is effective to symptomatic relief and provides good surgical exposure for resection of the elongated styloid process. The case demonstrates the challenges in diagnosing and managing Eagle syndrome, highlighting the effectiveness of surgical intervention when conservative measure fails. Surgical management, especially using a transcervical approach, offers significant symptomatic relief and a good prognosis. Clinicians should consider Eagle syndrome in patients presenting with unexplained head and neck pain, especially when conservative treatments are ineffective. A thorough diagnostic approach, including the imaging, is crucial for accurate diagnosis and effective treatment. Thank you.